How are
So
you?
I'm good. I'm a bit hot. Bad idea to wear a polo neck. I don't know why I thought
Yeah.
let me put this on. Um, so today we're going to be talking about hair loss treatments. Which is kind of interesting because we had a hair transplant surgeon on the other week, which was good. And he had some ideas. Although Ed's pretty, I guess, not old school. What's the word? Conventional.
You know what? The thing about I watched some of that, and I really want to go and see him. I think he's obviously knows his stuff. What a few people have been telling me though is after the transplant surgery, it's quite the rate of how you keep the transplanted hair isn't predictable, or it
Mm.
hasn't been as rewarding, or as it hasn't given them what they wanted. They've needed quite a few cycles of the treatment of the transplant surgery. So even some of the things that we do can help the success of transplant surgery.
I think actually, just going back to that, Ewan was saying that he wanted to go and get his temples done, as
We're
in
going to
to
go
put.
together.
Oh, you're
Look,
going to do it as well.
yeah,
Uh,
hell yeah.
you should go.
We'll
You should
go.
email him.
Maybe we can do like a story that day. I don't know. We'll
Yeah,
see.
I think that sounds like a good idea. So, he was talking about the use of finasteride mainly,
Yeah.
and minoxidil. So, why don't you tell us a little bit about your other treatment options?
Well, this is interesting. So, I pretty much stopped using finasteride, because you've got to forgive me because I did a little bit of combining my research for this in preparation for this. So I've used a mind map of some of the therapies that I use, and that way I've just put them up behind you so I can sort of refer to the correct things properly. But actually, finasteride is interesting because it blocks 5-alpha reductase, which is an enzyme which converts testosterone to dihydrotestosterone. But it only acts on type 1 of the receptor, whereas dutasteride acts on both types of the receptor, of 5-alpha reductase receptor, and therefore it's more effective. It's a larger molecule. It sits on the scalp longer, so it has a better efficacy. And the other thing is that its half-life is longer, so you only need to take the tablet twice a week. Whereas with finasteride, you have to take 2.5 to 5 milligram every day, right?
Yeah.
And also there's been some emerging reports about how long-term use of finasteride has this effect on libido, on mood, on just some non-related symptoms as well. So there's this condition known as post-finasteride syndrome, which is becoming more well known about now. And it's not in the beginning it's not as effective as dutasteride anyway. So I might as well recommend dutasteride for patients anyway.
Um, Two things. First of all,
Mm.
Paul Banwell, plastic surgeon, said on Instagram, "I'll join you when you go for your
Yeah.
hair transplant." I don't know if you saw that. So maybe the
So
three
maybe
of
the
you could
three of
go
us are going
together.
together.
Yeah. Just for clarity, the hair transplant surgeon that we're talking about is Edward Maitland Ball. Um, and that's all he does. He just does hair all day, every day. And somebody over on YouTube has asked doctors, do you have a favorite Bollywood movie before we start? Mine is Devdas.
Are you serious?
Yes.
Oh, he's saying this. I thought you were saying that, Sarah.
No, I know.
Um,
I have no idea what my favorite would be. You can pick one for me.
okay, Sholay. Okay, old school is Sholay, and then newest style. Oh, there's so many. I like Vire the Wedding. I don't know if anyone's seen that.
I
That's a
don't know.
naughty one.
I
Sarah, you
guess
should watch it. It's good.
we shall find out. Uh, Brandon just totally missed what you said about finasteride. Uh,
The
Nutshell.
finasteride acts on type 1 5-alpha reductase receptors, whereas dutasteride works on type 1 and type 2. And type 2 is actually more, blocking that is more effective in blocking the generation of DHT, so dihydrotestosterone.
Okay, cool. On
Yeah.
one of our videos, you were talking briefly about dutasteride injections, which is not approved for use yet. However,
Yeah, it's not licensed,
Perhaps.
but I think it's a fantastic treatment because it means that you give the dutasteride in a quite a dilute solution, and you put it you just deliver it where it needs to be having its action, so you don't need to put it all over. And you're reducing the systemic absorption and even the local absorption as well. So you just literally put it in the areas where you need the extra help. And the beauty of it is it's only delivered every 2 months. It's every 6 months as a maintenance treatment.
Oh, that's good.
Yeah, I've
And
done it for myself actually.
is that something that you're using on both men and women, or just men?
So if women are childbearing age, no.
Yeah.
It's still teratogenic, or potentially teratogenic. Even in a topical form, I don't want to use things that have a slight risk. So I prefer to steer clear of things like that in women of childbearing age. Definitely women who are planning families. No way.
So Zuzel just said, can dutasteride be injected? No need for pills. That's something which is currently undergoing approval for use at the moment. Yeah, as Kish was just saying.
So
Uh,
we're basically trialing on some select cases. We're working very closely with a company who's brought it to the UK, because it has to be in a certain formulation. So we're one of the few clinics that's going to be offering it. And I do think it's going to change the whole sort of hair regeneration practice in a big way, because yeah, that's one thing. But the other thing we can do with dutasteride is we can apply it topically where it has a very good effect, but you have to use it every day.
mm. Finasteride, just going back to that, as you know, I was taking that for a while. Someone prescribed that for me. My understanding of that is that it washes out after 2 days. Because I was like frantically Googling how long does finasteride last in the bloodstream. You know, for example, if somebody was to prescribe that for a woman of childbearing age,
Yeah.
how long do they have to worry, I guess, is the question that I'm asking you.
Yeah, at least like a couple of days. I'd probably say you want to if I'm going to recommend it to someone, I'll say stop the finasteride, wait 6 months, and then
Mm.
start planning a family, or start actively doing a family.
Well, that's assuming that we've got 6 months, Kish. Maybe we don't have 6 months.
Look,
So Zuzel also asked, it can be used alongside minoxidil. I'm going to say yeah.
yeah. So I'll tell you the first line treatment for men particularly is topical minoxidil, 2% or 5%, and add to that dutasteride as a tablet, 0.5 milligram twice a week. So even as a tablet, it's so good because the half-life is longer, and you can just take it twice a week. That's probably my first line.
And is that something that you're compounding?
No, that's so even if you can get minoxidil, as you know, as a pre-packaged licensed treatment, it's just not as effective as if you add in other things which enhance and they're additive to the effect. Because think about it, hair loss is why. Because hair loss is because we've got excess testosterone, the wrong type of testosterone. It's because we've got a lack of nutrients. We've got lack of nutrients penetrating the scalp, and we've got too much activity sort of promoting this conversion of testosterone to dihydrotestosterone. And one of your followers has said minoxidil always burned my scalp, but it's effective for regrowth. This is the biggest problem with topical minoxidil, is that it causes this like dermatitis reaction. So first of all, you can try the lower dose, which is a lower percentage, this is at Brandon Everett. Yeah, you can use a 2% if you're not already, or we can compound it for you so that it's a lower dose, so you still get the benefit of the minoxidil, but without the irritant effect.
We both look utterly radiant, says David. Thanks very much. It's the quarantine. That'll do it for you. You had a question then.
So next question.
About finasteride. Very sexy. Thank you, David. I'm presuming it's you. So Corey said, I want to start finasteride, but worried about side effects and horror stories online. Little emoji.
I mean, there's a risk to taking any any medication, right? And like, I can give you the averages, I can give you the risk ratio of what it's going to, how likely it is. I'd have to check that. But quite frankly, if it's you that it gets effective, that's irrelevant, right? So I think finasteride, when we've got something that has got that's got no reported side effects of affecting your erectile function or your libido, why not use that instead? And it's lasting longer as well, and has a better effect.
We've got some great comments going on in the chat right now. I'm loving that.
This is not fair.
I don't think it is. I think everybody's jealous about how cutting your cheekbones are for a man of your advanced years. So why don't you tell us a bit about that's kind of one of those horrible backhanded compliments, actually, isn't it? Why don't you tell us a bit about the other stuff then that you're compounding as well? Because as you know, I had this hair cream that was compounded for me by Hertzog, which had all kinds of wacky stuff in there.
Yeah. I mean, okay, so the top ones are Dutasteride and Minoxidil. And actually, I'll put Dutasteride as a topical formula as well. And that way you bypass all this headache of systemic complications or symptoms or, the horror stories that people are worried about. So you avoid all that by putting it in a topical formula, either a foam or a what's it called? Or a tonic.
Cream.
Or a cream. You can use a cream. But I find, the cream makes people complain it feels greasy. So if I give it as a tonic or a foam, it's dry, dry very soon. And in the morning you wash it out. Yeah. I don't know, people seem to tolerate it better. But you like the cream, then you can have the cream. It's up to you.
So mine's got melatonin in there and some other stuff as well. Care to comment?
Yeah, melatonin is brilliant. It promotes, the hair goes through these stages of why are you smiling?
Because what David said.
What's David? David, you loser. Wow. Okay. David, the answer is yes. Please apply lots, okay? Get it in there.
I heard it makes your bum bigger as well, David. You should try that.
David. No one's going to be able to resist you. Oh, they're all going to come sniffing around. What do I use? I use melatonin. I use 0.01% to 0.1%. And what it does is, the hair is in the growing phase of anagen. The anagen lasts for anywhere between, I think it's 2 to 6 years. So if in that phase, if you can prolong it, and then your hair is going to actually end up being longer and healthier, and you'll have more hair on your head. Jack.
You are terrible. You're terrible, David. And progesterone and estrogen?
Yeah. So for women, I'll use progesterone, estrogen, I'll use caffeine. So there's certain things which are kind of like my first line. So like I said, that's Dutasteride, that's Minoxidil. I'll use melatonin as well. I also use spironolactone and cycloperitone acetate as well. And these all basically block the effect of dihydrotestosterone on the receptors, and that prevents the shrinking of the hair follicle from a terminal hair into a vellus hair, or to a really fine, that kind of bum fluff hair that you can't see. Yeah, that's the process that's going on as we get older.
I was shocked actually to understand that blondes have got more hairs on their head than somebody who's brunette, but the diameter of the hair is very thin. Because I always thought I didn't have much hair. Turns out I've got loads.
You'll have plenty, but then if you do with a trichoscopy, you'll see that many of because I think you were saying that you wear extensions and all this as well, because of the hair thinning. I think if we did trichoscopy for you, you'd have a scalp full of hair, but a lot of the hair would be in that vellus state. It needs stimulation. So for you, one of the other principal ingredients I would use is latanoprost. Latanoprost, have you used it?
So I use it on my eyelashes and my eyebrows, which doesn't seem to be helping. But anyway, I am. But I don't think it's in the compounded formula that I'm using right now. I don't think.
Okay, so I use it for eyelashes for patients who've got sparse eyelashes as well. But I use latanoprost or bitmoprost, in hair formulas as well. And the reason is that you have prostaglandins.
Guys.
Are your dogs doing?
Yeah. Come here. Come here. Come here. Let me show you. Oh, look at this.
Oh God!
Oh,
Oh my God! So this is not my favorite.
no,
Where's my
it's
favorite
Sunday.
dog?
He's on the floor, but this one's smaller. Ooh, say hi.
Hello. He's gonna bark at me. Watch. Hello, Sunday. Let's see you bark. Growl
There
at
we
me. Yeah.
What were we
They are
talking about?
gorgeous.
I got
Yeah, we're
distracted.
talking about prostaglandin analogs like bitmoprost or latanoprost, and yeah, they work by balancing the prostaglandin. They're an analog of prostaglandins, and they prolong anagen of the hair growth cycle, and they increase the density of hairs on the scalp as well. So it's really one of my first line additions to a hair loss formulation. The other thing is, have you noticed when people stop using minoxidil, they start to lose the hair that they've gained, right?
Oh, somebody just said, look at the condition of that fur on the pups. Yes, he's using all Kishan's hair tonics.
Yeah.
Solely responsible for that. Oh, sorry, what were you saying?
What was I saying? I was saying, oh yeah. When you stop using minoxidil, have you noticed the hair you start to shed the hair again?
Okay.
So the gains that you've got with minoxidil, you lose them once you stop using it. So my strategy for this is I use something like latanoprost or bitmoprost, which holds onto the hair a lot longer. It's much more of a long-term benefit.
Someone had a question about, it was Brandon, about are you using PRP for hair loss much these days? We don't hear much about it in the States anymore.
We use it, don't we? I mean, I use a lot of it, actually.
Yeah.
I'm looking up PRP now because I made a little thing. Yeah, so I think PRP has been shown to be really effective for stimulating hair follicles that are dormant. If the follicle is empty and you haven't got a hair that's possible to regenerate in there, PRP will do nothing. So usually if someone's had hair loss within a sort of a 15-month period, I think PRP and all of these treatments, in fact, are really, really helpful. But if it's a few years, then the results are not so predictable. What the research is also saying is that we need to sort of have some better, a lot more study into the type of protocols that we should be using for PRP. I don't know, I'm doing every 4 weeks and I'm doing 3 to 6 sessions. And I find it works better for people who've recently had hair loss, like in telogen effluvium.
Mm-hmm.
In pattern hair loss, in female or male pattern hair loss, it's a little less predictable, but I think women do a little bit better with PRP.
Someone's just said, Brandon again, all of the hair loss doctors in Atlanta say it's not effective unless you get the transplants first. Is it true?
Look, anecdotally, I've had patients who've not had hair transplants, who've had PRP, and they have come back, and you do the trichoscopy, you look, you examine them, and they've got regenerated hair. They've got follicles that are healthy and growing again. So I think it's your experience. I mean, you can find papers that will support PRP, and you'll find papers that will not support it. So it's controversial in that sense. Yeah. But anecdotally, I can tell you that particularly in younger patients who've had hair loss problems within the last 2 years, PRP is very effective. But you have to have about six sessions, I think. Go on.
Actually, in one of the YouTube videos that we did about hair loss, somebody mentioned that they'd had exosome done instead of PRP.
Yeah.
Any comments?
So Exokine is 10 to 100. Exokine PRP was based on orthokine, wasn't it? And that is 10 to 100 times more growth factors than the conventional Solenis, for example. Solenis is a ubiquitous PRP machine that's used in many clinics. But even our machine is producing more growth factors, and it's amplified. It's an amplified system, as far as I remember. So you get more growth factors than you do with the standard PRP machines that are in most clinics. So I think that's where we stand a little bit differently. Because we use Angel and we use the ACP, don't we?
That's correct. We've had a question from Emma, who is 40, feels like her hairline slightly receding, particularly at the temples. Any advice?
So the question is, how long has this been going on for? Has there been any major stress in the last 3 or 4 months? Because telogen effluvium is much more common with women. You see it. You've come across telogen effluvium, right?
Yeah. I'm just going to check the audio. One sec. Just keep talking.
So, if, for example, telogen effluvium is really common in women and men as well, obviously, but you just see it more because the hair thins in response to stress. Now, this can be a physical trauma or a psychological trauma that's taken place about 3 or 4 months before. The hair goes into telogen, which is the resting or the dead phase, and it's lost its blood supply, but it's sitting in the follicle until it's shed. And that can take up to, I think maybe even up to 6 months as well. So people notice that their hair comes out in their brushing or in their shampooing, and it becomes, visibly thinner. But you have to lose a really high percentage of your hair for it to be noticeable. But often most people see it in their brush or in the plug hole. And so my point was for this question is if the hairline seems to be receding, I mean, first of all, I think women of a certain age, it's very good to check a full blood count to make sure there's no underlying anemia, to make sure that the thyroid function is good. And I don't mean a standard thyroid function test that you do at your GP, because sometimes you can miss the thyroid hormone, which is called T3. When that's low, that's a really common cause of losing hair, particularly in the hairline. So I would say, a good functional workup is a good thing, where we look at your blood count, we look at your thyroid levels, and we look at your nutritional deficiencies as well. That's what I would recommend for someone, and that's a good starting point. And then once you know what you're dealing with, then you can recommend topical things or PRP or whatever.
We did have a question about, are you injecting the PRP? The places around Corey, just put it on the surface and microneedle it in. Edward Maitland-Ball, who was a hair transplant surgeon that we had on the other week, he's got a nurse who does it for him, and she does it with a mesotherapy U225 gun. What's your preference?
I use mesotherapy needles as well. But if you think about the depth of the hair follicle, the hair root itself, it's going to be 3 or 4 or 5 millimeters into the scalp. So you need, I just think if you're going to give the growth factors, they will find their way into the vasculature, into the tissues. But why not make sure you've got it into that level, into that plane?
Yes.
Yeah. If you just do microneedling and you're just doing maybe 1.5 millimeters, you're not delivering the growth factors to the level it needs to be, in my opinion.
Okay.
I'm sure you'll still get some regenerative effect because of, like you do with microneedling on the skin, you get some stimulation of collagen because of tissue levels deeper below. But I think when you're dealing with hair, I think you need to deliver the growth factors at the correct plane.
We did have a question as well about alopecia areata, whether or not PRP is working in alopecia areata.
So alopecia areata has got some very good first-line treatments that you should be using first. Alopecia areata, just for your viewers, it's like it's a focal hair loss, and it leaves these coin-shaped areas of lost hair. And the good news is that usually it gets better by itself. But for some unlucky people, it can actually take over the whole scalp, and that becomes alopecia universalis. This is like an autoimmune condition. But anyway, the first-line treatments for alopecia areata are things like topical steroids, or sometimes injected steroids. What else is good? I mean, the conventional treatments is what I would start with first. And then there's some emerging therapies which do include PRP, as you say, as your follower asks. And then the other major advancement is JAK2 inhibitors. So these are something kinase inhibitors which are involved in the disease process of alopecia areata. Yeah, so alopecia areata, the emerging research is showing something called, there's a medication called Janus kinase inhibitors. And the clinical trials for them are really, really looking good. 40 to 60% regeneration of those patches that are left by alopecia areata. And then there's another good piece of news is that they found that there's a much lower dose of steroids that's given to patients. I think it's only it's only 2 days a week that the steroid is given by mouth, and they found 60 to 70% regrowth just on this very, very conservative steroid dosing pattern. And then the emerging therapies for alopecia areata are PRP and stem cell treatments as well.
Where are people taking those stem cells from?
I think behind the ear.
I'm
not sure. And there's a couple more. There's a low dose naltrexone, which I think you've been learning about as well, haven't you?
You like that, don't you?
I love it because I've run out of it, and it's actually giving me trouble because I've got an autoimmune thing, and I've run out of my little supply. So with low dose naltrexone, it's managed really well. The other thing that's really been shown to be very effective for hair loss in general, by the way, is low level light laser therapy. So depending, and what you generally get a cap, and this is from the same manufacturers that are providing this Dutasteride formulation. You wear the cap every day, and then it pulses red LED light in a very controlled way. Depending on your level of hair loss, you just use it every day. It's completely non-invasive. There's no drugs. But the research, the dermatology research and the papers coming out on this have been shown to be really, really effective for hair loss, or in terms of all types, even alopecia areata.
Somebody asked as well, I think you mentioned this actually, if it's a woman, are you doing hormone testing as well before you prescribe anything for hair?
It depends on the patient, to be honest. So if they are keen and they are happy to have the testing done, that's the best way to do it, because, like I said, thyroid is the biggest cause of hair thinning and thin hair, thin skin. If a female patient is deficient in thyroid, we resupplement the thyroid health, and the hair becomes thick again. And that's a really good strategy. But you can't do that without testing for the thyroid in the beginning. The other thing that's very important to test for is a full blood count and nutritional deficiencies, and then also hormones. So if you're entering perimenopause, or if you've got PCOS, polycystic ovarian syndrome, then that's another reason why your hair may be thinning or why you might be getting patches. So ideally, yes. So the answer is yes. Ideally, let's test first. Let's see where you are hormonally, make sure that there's no underlying problems, and then we can really recommend like a tailor-made program for you.
Smashing.
Otherwise, we're just shooting in the dark, right?
Yeah. Hi from Argentina and hi from Brazil. Lovely. Never been to Argentina.
Where are you seeing these people?
It's on Instagram.
Oh, hello. Dante Dominguez. I want to go to Argentina, actually.
Yeah, it's on my list. Actually, I want to go back to Brazil first.
Yeah, me too. I would love to go to Brazil.
Yeah, it's a real wild ride. So, is there anything that we've missed?
Okay, let's have a look. I'm looking at my little mind map here, which we've completely gone off. We've completely gone off Kelter here. Minoxidil. You can take it by mouth as well, and that avoids. This follower of yours was saying he keeps getting this irritation. You can take minoxidil by mouth, about 2.5 milligram a day. So that's another strategy. And then you avoid all this dermatitis, and there's not been any irritation from the skin, and there's not been any low blood pressure, which is one of the symptoms that was reported in the beginning with minoxidil.
Cool.
Let me have a think. Stem cells, prostaglandins. We have talked about there's some things which really enhance hair growth. So I think azelaic acid and tretinoin. So again, if we do these topical formulations, you can use things to improve the quality of the skin of the scalp, and that has the knock-on effect of improving the hair quality as well. So tretinoin at a very low dose in our formulas, and azelaic acid as well, is a very, very good thing to promote the health of the scalp.
You got your phone right over your webcam.
Oh, sorry.
Yeah.
How's this?
Yeah,
I don't know where to hold it.
I have a special thing to hold mine, so that's how I do it. Yeah.
It's my birthday in January. Actually, it's Christmas. Oh God, there must be something.
End of quarantine.
Just send me the link, Sarah. Send me the link.
Was there anything else that we've missed?
So PRP. What is your strategy? How do you do PRP?
What, in the scalp?
Yeah, do you use meso needles?
Yeah, I do, but I don't like doing it because it's painful. You know me, I'm all about the face. I'm all about the face.
Yeah?
Yeah, I enjoy that.
But you can have like a beautiful looking face, and then if your hair is not looking healthy and lush, then you know.
Yeah, but that's why I send them to you. So, yeah. Okay, cool.
You see, because you're the queen of injections, I just thought, you know, any injections you'll be on board with, you know.
Yeah. Okay, cool. Well, I feel like we've probably covered everything there.
Yeah.
That was great. Thanks so much for joining us. And I'm glad we got the technical issues sorted out in the end. Hurrah.
Yeah.
Nice to see you.
See you.
All right. Bye.
Bye. Bye. Bye.